Touching on the challenges experienced with youth in COVID-19, Minister of Health Dr. Frank Anthony stated that the younger population are not taking the deadly respiratory disease seriously and as such have been taking more risks. Minister Anthony, sending a stern coronavirus warning to young people, unveiled that they are now seeing long COVID cases locally, where organs in addition to the lungs are affected by COVID-19 after recovery.
Young people who would recover very quickly, in a couple months' time, they can also have what is now termed as long COVID, where they can feel fatigued, or we're now seeing cases of cardiac diseases and so forth.
This was divulged during the launch of the first Caribbean Congress Adolescent and Youth Health Roadmap on Monday afternoon. Minister Anthony added that as the government of Guyana navigates its way through the pandemic, focus will have to be shifted to this area. Honing in on other challenges, the health minister said that abuse, irrational fears, and anxiety have been disrupting the mental health of youth. He went on to say that locally there is not a robust system which can effectively alleviate the mental health challenges of youths at home. Also highlighting the significant strides Guyana has made over the years to address adolescent and youth health, Dr. Anthony pinpointed the adoption of the National Sexual and Reproductive Health Policy, the introduction of health clubs in schools, and the creation of safe spaces for youth.
We have also been working at our health centers and health clinics to create youth-friendly spaces. And so we now have in about 52 health centers what we call adolescent health and wellness clinics, so that young people can come to these clinics and they would not be troubled by adults who are providing care, but rather they would be embraced.
However, he revealed that the COVID-19 global health emergency has disrupted progressions made by the health sector. Following a passionate speech from UN coordination consultant Michelle Belfour for the need of comprehensive sexuality education (CSE), which helps you to delay early sexual activity, prevents pregnancy, and reduces the contraction of HIV and other sexually transmitted infections, Minister Anthony was convinced for the need of the CSE in schools. He, however, reminded that this move is heavily dependent on stakeholder support.
One of the stakeholders I think that we'll also have to look at is really the faith-based organizations, because sometimes there's that narrow view that if we teach sexual and reproductive health in our school system, that is somehow promoting promiscuity.
Of the issues raised by the advocates to be addressed were mental health, substance abuse, violence and injuries, sexual reproductive health and rights, HIV/STIs, nutrition, sports, youth development, and climate change. The recommendations demanded meaningful engagement of youths in decision-making, political commitment and investments, building capacity of youths to support development, supporting the use of research by universities and other institutions to support evidence-based interventions. For the HGP Nightly News, Amel Griffith.